ICD-10 Chapter 1 Practice Questions Medical Coding Study Guide, 30 Need-to-Know Questions. Question 1. ICD-10-CM Chapter 1 covers which range of codes? A00B99, C00D49, E00E89, M00M99. Chapter 1 is certain infectious and parasitic diseases. Question 2. How is sepsis coded when the underlying infection is known? Code the infection first, then the sepsis code. Code the sepsis first, followed by the specific infection. Code only the infection. Code only the sepsis. Guidelines state to code the systemic infection, sepsis, first. Question 3. When a patient has HIV-related illnesses, which code is sequenced first? B20. The code for the illness, example pneumonia. Z21. 098.7. B20, human immunodeficiency virus, HIV, disease, is sequenced first if the patient is seen for an HIV-related condition. Question 4. The code Z21 is used for symptomatic HIV, asymptomatic HIV infection status, exposure to HIV, inconclusive lab evidence of HIV. Z21 is used when a patient is HIV positive but has no symptoms or related conditions. Question 5. MRSA colonization means the patient has an active MRSA infection. The MRSA is present on the body but not causing illness. The patient is allergic to MRSA. The patient is immune to MRSA. Colonization, Z22.322, means the bacteria is present without an active infection. Question 6. Which code is used for Zika virus disease? A 92.5, B20, a 00.0, B99.9. A 92.5 is the specific code for Zika virus disease. Question 7. If a patient is admitted with sepsis that progresses to severe sepsis with organ failure, the organ failure code is sequenced before the sepsis code, sequenced after the sepsis code, not coded at all, the only code used. The code for the underlying systemic infection is followed by the code for the organ failure. Question 8. Candidiasis of the mouth is commonly known as sepsis, thrush, shingles, scabies. Oral candidiasis is thrush, B37.0. Question 9. What is the code for symptomatic HIV? B20, Z21, R75, Z11.4. B20 is used once a patient has developed an HIV-related illness. Question 10. Which code is assigned for COVID-19? U07.1, J12.89, B34.2, Z20.828. U07.1 is the specific code for confirmed COVID-19. Question 11. Tuberculosis is found in which code range? A15A19, B00B09, A30A49, B25B34. Tuberculosis codes are in the A15A19 range. Question 12. B95, B97 codes are used as primary codes for infections, supplemental codes to identify the infectious agent, codes for symptoms, codes for external causes. These codes are used as additional codes to identify the specific organism. Question 13. Viral hepatitis codes begin with A, B, C, D. Viral hepatitis codes are in the B15, B19 range. Question 14. A patient is seen for suspected HIV. The coder should code B20, code Z21, code only the symptoms or the reason for the encounter, code R75. Never code HIV based on suspected or possible status, code symptoms instead. Question 15. Sepsis due to a post-procedural infection is coded as a complication of the procedure first, with B20 first, with Z21 first, only with the sepsis code. The procedure complication code is sequenced first. Question 16. Which of the following is an example of a parasitic disease? Influenza, malaria, chickenpox, diabetes. Malaria is caused by Plasmodium parasites. Question 17. Sequela of an infectious disease is coded by the acute infection code, the condition resulting from the infection followed by the sequela code, only the sequela code, the sequela code followed by the infection code. Code the residual effect first, then the sequela of code, example, B90 B94. Question 18. Whooping cough is also known as rubella, pertussis, mumps, diphtheria. Pertussis is the medical term for whooping cough, A37. Question 19. Foodborne intoxication is coded in which range? A00, A09, B15, B19, C00, C14, D10, D15. Intestinal infectious diseases are in the A00, A09 range. Question 20. Infectious mononucleosis is found under code B27, B01, A50, B15. B27 is the code for infectious mononucleosis.